is Dr. Charles Moore. We are at the Healing Community Center. Our facility here provides comprehensive integrated care, and we do that in a way that's a little bit unique in that we make all of our services really accessible to the community. We started really about 7 years ago, if you take into consideration the initiating steps, and it started out of the back of my car. I'm a physician at Grady Health System in Emory, and at Grady I do a lot of head and neck cancer. I'm an otolaryngologist, but my specialty really is in anterior skull-based cancers and craniofacial reconstruction, and I do trauma. But at Grady I would see a number of folks that would come in on a regular basis with head and neck cancers, so cancers of their mouth and their tongue, or of their jaw, or of their neck. And those cancers had really progressed to such an extent that they really had no treatment options, and the only thing we could do would be to do something that was just temporizing, and really not do much for them in terms of regenerating their ability to go back to their regular life. And I would see that regularly, and each time I see it, I would say to myself, somebody needs to do something about this. And seeing that day after day and month after month and year after year, and each time saying to myself, somebody needs to do something about this, until one day I thought, well, maybe it's supposed to be me. And with that, I initially looked at the areas where I was seeing the majority of the head and neck cancers that were coming to my clinic, and I initially just got in my car and started driving to those zip codes, and I looked at the top 3 zip codes, and all of those were really in severely underserved areas. What you find in most underserved areas is there tends to not be a lot of resources in general, not be a lot of grocery stores, not be a lot of banks or any types of amenities. And I focused on, again, on the top 3 zip codes that had those conditions. And initially, after I went out and met folks and just talked to them to see what their needs were, I gradually thought that maybe I could do what I knew best, which I thought at that time was head and neck cancer. And so I started doing head and neck cancer talks, and then I began to expand that to head and neck cancer screening, so looking in the mouth and showing folks how to feel your neck to feel for lumps and bumps. And then I saw all the medical needs that weren't being addressed, and started to relearn primary care and started doing general medical care. I then started to ask some of my colleagues to come along with me, and from those humble beginnings in my car, we've grown to a 6,000 square feet facility that now does general medical care, pediatrics. We specialize in a number of specialty cases or specialty care, such as ENT, of course, audiology. We do cardiology, podiatry and wound care, OBGYN, diabetes classes and general diabetic care, health education classes, and mental health services. And all of that we integrate together so that people are treated with dignity and respect in a way that really promotes health, so we do more preventative care. One of the things that seems to occur is that by creating the Healing Community Center, we've created a place where health professionals can come within your own backyard to provide and utilize those special skills that they have. Sometimes I think folks think that you have to go to another country to do volunteer health care work, which is wonderful, but it's right in our backyard. It's really right in our front yard. And so for global health issues, you don't have to go to another country. You can go right down the street. It's great, again, to do things in another country, but we have the same issues here. And it's something that we can address by working together. You know, I'll be honest, when I first went out, when I was driving around in my car to various areas, I wasn't necessarily welcomed by some places, and I understand that because what had happened in the past is they had been burned by other people, where, you know, really well-intentioned folks had come to the area, said they're going to do all these things, and then didn't do anything. So what I always made sure, and I continue to do, is whatever we say we're going to do, we make sure we do that and try and go a little bit above that. And by creating really a path that will allow other health professionals to come along and be a part of that, so it's not so foreign to other folks, and you're able to use those talents and skills. Well, there are a number of things. You know, financial support is always welcomed because, as you stated, it takes quite a bit to run a free facility, and even in a sliding scale facility, it takes quite a bit of funding to keep that going. Providing their own special skills and talents. We, you know, can use volunteers, especially for our big events that we have in the community, because we still do several events throughout the year, providing health screenings and long-term health promotion throughout really all of Atlanta. They can, depending on their skill set, they may want to volunteer on site with our organization or with other health organizations. I think a key to our success is that we collaborate with folks, and that's really essential. And there are a number of good organizations that would love to have folks come out and, you know, give some time. Well, you know, all of my time here at the Healing Community Center, I volunteer my time here completely. So I still have my day job, and but you get much more than you give. And I think most healthcare professionals really go into the field of medicine because they want to help people. And somehow, sometimes during the whole process of the training, that gets lost a little bit. But, you know, in my experience, I think there were a number of individual stories that I think that there's a certain level of despair that touches something in everyone. And you get to a point where you can no longer just, you can't look away from that, but you feel that you have to do something. And if I'm being completely honest with you, I had no idea that this was going to grow into this. And also, if I'm being completely honest, when I first started, I really didn't want to tell folks, because if it failed, what was it? You know, you really didn't want people to know about that. But I realized that the need was so great that there's no way that I could do all this on my own, and that I needed support and I needed to collaborate. And once I did that, I saw that it made things easier for other folks to come along because the path had been started. And back to your original question, I think, you know, just personally, just seeing folks that are so grateful for really small things that many people take for granted, but they otherwise would not have access to it. That's really rewarding, and you really do get so much more than you're giving by doing that.